Good evening. This is Dr. Kurt Wohler. I appreciate you joining me for tonight's webinar. The topic we're going to be discussing is information on cholesterol and oxytocin specifically, with implications towards autism as well as mental health disorders in general. So with that, let's go ahead and get started. Before we head into the lecture, just a few things I want to make you aware of if you're new to these webinars. My main website, where you can find information about me, upcoming lectures, speaking engagements, links to books, etc. Just go to drwohler.com. And then I've written a number of books with respects to autism. This was one particular book called Autism: The Road to Recovery, and this is actually an ebook that you can download. Just go to autismrecoverybook.com if that is of interest to you. And then for ongoing questions, assistance, second opinion, troubleshooting, etc., there's a very comprehensive website that I have called autismactionplan.com, and this is it's a membership website where people join on a monthly basis and they can ask questions through a forum. There's even a section for private messaging. So if you have questions about tonight's webinar, for example, this would be a great place to post those. And so this is a website that's been in existence now for 4 or 5 years, and I work with people all over the world, actually helping them answer some of their questions with respects to biomedical intervention. So autismactionplan.com. Okay, so what we're going to be talking about tonight is cholesterol. What is it? What are its main functions? What happens when problems or the cholesterol is low? We're going to talk about oxytocin and cholesterol, and then we'll talk specifically about some natural remedies that can actually raise cholesterol, and more specifically about oxytocin therapy as well. So first off, let's jump in and talk about what is cholesterol. Well, cholesterol belongs to a class of molecules called steroids, and actually it's a waxy, fat-like compound that has this little OH group at the end of it. It actually comes from the word, a Greek word for chole, which means bile, and steros, which means solid. Now, its main functions is, one, it makes up the structural component of all animal cells. And what it does is it provides some fluidity and permeability to the cells. It also helps animal cells resist temperature changes, which is important from a survival standpoint. It makes up a large component of the myelin that protects our nerve cells in the nervous system. And it's also a precursor to a number of steroid hormones and sex hormones, particularly progesterone, testosterone, cortisol, and estrogen, are all created based on a foundation of cholesterol. We need cholesterol in order to produce bile acids, and of course bile acids are critically important for things like vitamin A, vitamin K, vitamin D absorption. And then cholesterol finally is involved in vitamin D conversion in the skin. So we've heard a lot about the consequences of high cholesterol, whether that's coronary heart disease, carotid artery disease, peripheral arterial disease, where we get a buildup of cholesterol plaque in a damaged lining of the blood vessel, which can lead certainly to serious problems with the heart and vascular system. But what doesn't get much press, although there is a lot of research out there, and it's been out in the medical literature for years, is the consequences of low cholesterol. And if we think about it from a mental health standpoint, there is evidence linking low cholesterol to anxiety as well as depression. This was research going back to 1991. Low cholesterol being associated with depression, research back in December 2011, and then even suicide. So low cholesterol has been associated with an increased risk for suicide. And then, of course, if we talk about more general medical conditions, stroke and cancer are with low cholesterol are at increased risk. And then even, from the National Institutes of Health in 2007 reporting that low cholesterol is a risk factor for premature births. So there's actually quite a bit of literature out there with respects to low cholesterol. It just doesn't get a lot of press because everyone's so hyper-focused on the problems with respects to high cholesterol. Well, what are some potential causes of low cholesterol? It turns out the thyroid, particularly hyperthyroidism, overactive thyroid, can cause low cholesterol. Liver problems, malnutrition, malabsorption of nutrients from the gut, anything that's going to cause a gut problem can be a problem for low cholesterol, even gastrointestinal infections. Manganese deficiency, interestingly enough, which is a mineral, it can be associated with low cholesterol. And then there's a specific genetic disorder, which we'll talk a little bit more shortly here, called SLOS, which is an enzyme defect that prevents an individual from making adequate amounts of cholesterol. So one of the things to look at if you're a practitioner and you've got a patient with low cholesterol, or you're a parent, or you're a patient yourself, struggling with some health challenges, these are some things that you can look at to assess low cholesterol. Essentially doing standard blood testing. Most any lab can do these, where you look at liver panel, total proteins, globulins, what's called a comprehensive metabolic panel, just to see if there's any defect going on metabolically. I recommend doing a thyroid assessment just because we know that hyperthyroidism can be a contributing factor to low cholesterol. And then some specific tests which are actually available from Great Plains Laboratory. An essential fatty acid profile can be helpful. A hair mineral analysis, again, looking for some type of problem with manganese deficiency. Looking at a comprehensive digestive stool analysis for digestive markers of imbalance, maldigestion. And then one of the things that I always go to for most any patient, whether it's a child with autism, an older individual with mental health problems, etc., is the organic acid test. And really the organic acid test is it's the foundation of Great Plains testing. It has so many, it can be applied to so many different kind of health conditions, primarily by looking at yeast and bacterial toxins, oxalate issues, mitochondrial defects, etc. So this is an excellent test to run. And it crosses over to many different types of health conditions, from anxiety to depression to learning difficulties to autism, as people I'm sure who are listening know, etc. So the organic acid test is a real good go-to test to have done. But again, those other tests that I mentioned can be important as well, particularly if you have a situation where your child continues to have low cholesterol, or you have a patient who continues to have low cholesterol. You got to start looking for other reasons why. Well, let's core a little bit here about low cholesterol, and this specific slides are related to autism based on an article Dr. Shaw from Great Plains Laboratory wrote a number of years ago called Deficient Cholesterol, a Common New Factor in Autism. These slides on this part of this presentation are only applicable to autism, okay? So expand your thinking and follow along with me on this. This genetic disorder called SLOS, we know it's a genetic disorder that affects the body's ability to make cholesterol. And in some cases of SLOS, these kids have actually shown up with extremely low levels of cholesterol. And then they have the cholesterol precursor, which is high, called 7-dihydrocholesterol. In one particular study, 75% of those with SLOS. Now, there's a specific physical characteristic that many of these kids have. They have a fused second and third toe. They usually have lack of speech, severe abnormal behavioral problems, tempers, tantrums, hyperactivity, sometimes self-injurious behavior, and many of these kids are also very sensitive to UV. Problems in SLOS is that as the lower levels of cholesterol there were, the more increased or more intense the behavioral problems were. And then obviously as their cholesterol levels went up, the more mild the cases were. And this is a common pattern. Now again, if we look at the formation of cholesterol, what I mentioned, SLOS affects the ability of the body to convert 7-dihydrocholesterol to cholesterol, and you get a relative increase in this 7-dihydrocholesterol precursor. Now, cholesterol, as I mentioned, plays a lot of roles in steroid therapy, so it is a precursor to things like estrogen, testosterone, cortisol. As I mentioned, it's also important for bile salt formation to help with fat-soluble vitamins. And so it plays a significant role in the endocrine system of our body as well as the gut. If we look at a deeper slide here with respects to hormone production, we see that cholesterol is sort of higher up in the food chain. And as cholesterol comes down, the first thing it's converted to is pregnenolone. And pregnenolone has a relationship to progesterone as well as aldosterone to support cortisol level, and pregnenolone can then. So a lot of times people who have adrenal insufficiency, or I should more correctly say adrenal exhaustion, oftentimes will have low cholesterol levels too. So it's not to say that just fixing the cholesterol will fix an adrenal problem, but can help individuals who are adrenally fatigued. It's something that I commonly look at. Now, we know that cholesterol makes up a percentage of the cell membranes. As I mentioned before, it's important for the pliability is making up the bulk of the myelin. Matter of fact, the myelin sheath, which is that protective envelope, if you will, around our nerve cells, that myelin is what helps the speed of electrical conductivity within the nervous system. And about 70% of the cholesterol in the brain is associated with myelin. Okay, so we know that the brain is a significant resource, or I guess you could say, is made up of a lot of cholesterol in different areas. Well, risk factors for low cholesterol: increased cancer, increased violent behavior and aggression, increased susceptibility to infections, suicide, anxiety, depression, bipolar. So from a mental health disorder standpoint, it's clearly a problem. For kids on the autism spectrum, anxiety is a big problem. I've seen a lot of kids improve with respects to their anxiety by working on their cholesterol levels. So it has a lot of applicability to many different types of people. Great Plains actually did a study a number of years ago where they took a group of children on the autism spectrum and looked at their blood with respects to cholesterol. And what they found is, about 57% actually had cholesterol levels less than 160, and ideally would like to see our cholesterol levels around 160 or higher. We can make the case about 170, 180 from a total cholesterol standpoint would be nice. About 17.5% of those kids studied actually had levels that were less than 100. The lowest that I've seen in my practice was 60, I think it was 63. Extremely low, but I know that there's some of the SLOS kids can be a lot lower. On average, what I see in my practice with kids on the spectrum is cholesterols between 100 and 120, on average about 110, 115 in that range. And to help address this problem, I created a website a number of years ago called Get Sonic Cholesterol. And it's called GetSonicCholesterol.com. This is where you as an individual can actually access Sonic Cholesterol, which is a cholesterol supplement from New Beginnings Nutritionals that is helpful to bring in healthy levels of cholesterol. And it's particularly useful for people who have egg allergy or egg sensitivity. So if you're an individual who's looking to, get Sonic Cholesterol, if you've heard about it before, or if you found out that you have low cholesterol, I encourage you to go to GetSonicCholesterol.com. You can read through the instructions on actually how to order Sonic Cholesterol. I have a lab review service through here that I assist people with, and it's been an effective website, and sonic cholesterol particularly has been an effective therapy. We'll talk about sonic cholesterol here more in depth in a short while. Okay. One of the things that brought to light the issue of cholesterol problems in autism was really information that came out of the National Institutes of Health, and where they had done a large meta-analysis of different types of health disorders, and actually found that in people who had cholesterols less than 160 had a 10 to 20% increased death rate. They also were more susceptible to things such as depression and anxiety, cancer we mentioned before, violent behavior, and behavioral volatility. And this is clearly something we see with kids on the spectrum. Clearly this is things that occur with individuals with certain mental health disorders. So for a cross-section of the population, low cholesterol is certainly likely and should be evaluated more thoroughly. Well, if we go back to the SLOS group, these kids with this genetic disorder, and they were actually given cholesterol therapy, they were basically fed cholesterol. If you look particularly here in the red at what improved, increased sociability, improved behaviors, improvement in talking, and in many of these kids, the improvement happened very quickly. What I've seen in my practice, when I've given sonic cholesterol as a therapy, many parents will report sometimes within the first week to week and a half an improvement in these areas: decreased irritability, more calm, less anxious, etc. So it's a worthwhile thing to look at. There are certain foods that are high in cholesterol. What most people are going to have access to is eggs. 2 large eggs is about 500 milligrams of cholesterol. Brain and liver are other sources. Not too many people eat these, but here in the U.S. certainly eggs are a source. But again, eggs, many people do have egg sensitivity. And so a number of years ago, New Beginnings came up with sonic cholesterol. It's a hypoallergenic. It's not an egg source cholesterol, so it's okay for people who have an egg allergy to take. There's no toxic metals, no chemical exposure through sonic cholesterol. And it's been very effective. 1 capsule is approximately 250 milligrams of pure cholesterol, which is about the amount of cholesterol you would get through 1 large egg. Okay, the capsules can be open. They can be mixed in food, mixed in drink, and it's a nice way to actually give the sonic cholesterol. And this is available through New Beginnings. For those of you who would like more information about how to access sonic cholesterol, just go to getsonic-cholesterol.com. Okay, so we know that cholesterol is important from a general health standpoint, but I started asking the question, a number of years ago, and that was, why am I seeing particularly kids on the spectrum improve many times within the first week, 2 weeks, calmness, eye contact, less anxiety, etc., by putting them on cholesterol therapy. But then when I retested their blood, maybe 2 months later, there wasn't a significant increase in their blood level of cholesterol. And I started thinking, I wonder, there must be some other mechanism that's going on, possibly some other effect that the cholesterol is having within the central nervous system that's just not registering on the blood, that the cholesterol may be having an effect with. So I started doing some research on that and came across some intriguing data that was showing the relationship between cholesterol and oxytocin, and specifically cholesterol with respect to the oxytocin receptor, where the cholesterol helped to improve the binding of oxytocin as well as increase the stability of oxytocin at its receptor site. Well, what is oxytocin? And this is something that is being hotly researched now in autism, and it certainly has applicability to other types of mental health conditions as well. Oxytocin as a hormone is responsible for uterine contractions. It helps to thin the cervix in preparation for delivery. It's also a bonding hormone that's released between the mother and child during breastfeeding. It's released in all of us throughout our lives. It helps to increase sexual relations, intensify sexual relations. It can help improve feelings of trust, pleasure, and harmony. And as a therapy, it's actually been helpful for some people with anxiety, particularly social anxiety. One of the forms in how it's given, and it's been used this way even for grief therapy, is nasally, from an intranasal spray. Now, the synthetic oxytocin called Pitocin is given during labor to help induce uterine contractions. The problem is, and this is really more for another presentation, but there seems to be a potential inhibition of the child's natural oxytocin production if they have been given Pitocin. And the theory behind this is that right after birth, for those 7 to 10 days, that critical period of time of development, where there's a lot of things happening, if there has been Pitocin in the system, there is a potential, and I say potential, for inhibition or partial inhibition of a child's own production of oxytocin, and the impact that that might have on certain brain centers that are related to facial and voice emotional recognition, as well as bonding. And we'll talk more about that and look at a few areas specific to that. Well, it turns out that there are some individuals on the spectrum who actually have what's called a polymorphism, which essentially it's a fancy word for having a defect in their oxytocin binding receptor. Okay, and so if there is a receptor defect, their ability to bind oxytocin can be compromised. And so this may explain why some kids seem to have more social deficits. They lack, visual recognition, facial expression recognition, because it purely could be occurring that their oxytocin receptors aren't binding effectively at the cellular level. And when we're talking about binding, we're talking about this receptor, this lock and key mechanism, where we've got a key that unlocks, unlocks a lock essentially. Well, a chemical has a specific receptor, the chemical being the key and that receptor site being the lock. These two things have to be in harmony to open up that doorway or open up the cell for incoming information. And so if we've got, let's say this is oxytocin, but we've got a defect here in this receptor, these two things can't bind effectively. Well, it turns out that cholesterol not only helps to increase the stability of the oxytocin receptor, but cholesterol can also help to improve the overall function of the receptor, and as I mentioned before, increase the binding efficiency at the oxytocin receptor. And so this is likely why cholesterol therapy, when it's given even early on, is having a positive influence on individuals' mood, behavior, anxiety, etc., is that we're getting an increased binding effect at the oxytocin site. Okay, so we know that in impairment in oxytocin, whether it is a lack of production or a binding problem at the receptor site, essentially we've got an oxytocin, let's call it dysfunction, if you will, can manifest as poor facial pattern and facial pattern cue recognition, poor social cue recognition. Many other traits can be difficulty in coping skills, sometimes ritualistic and repetitive behavior, lack of bonding, and all of this can certainly manifest with anxiety, aggressiveness, and irritability. If we take this a little bit deeper and we look at the brain specifically, there is a particular area in the brain called the fusiform gyrus. And the fusiform gyrus is an area that is involved in recognizing faces. It's actually part of the temporal lobe. And the temporal lobe, if you put your hand over your ear, essentially you're putting your hand right over top of the temporal. That's where the temporal lobe sits, right and left. And this is an MRI image here, a cross-section of an looking at right here on the inferior medial aspect of the temporal lobe is the fusiform gyrus. Now notice that this particular image here shows yellow and red in the non-autistic individual, and in the autistic individual that yellow and red area is gone, okay, and that would be an area that in autism. It's showing us that we've got poor metabolic activity in the part of the brain that's related to facial expression recognition. And then this just takes it a little bit closer here. It turns out that areas in the red are showing where the brain is more active with face perception, and the blue are areas that are more linked to non-face objects. Okay, so not only in the neurotypical individual, but in the individual with autism, the non-face objects light up pretty strongly. But obviously the areas with respects to active face perception are, almost nil in the individual with autism. Okay, and was that autistic individuals showed a greater fusiform activity with familiar faces versus strangers' faces. So essentially what it's getting at is that individuals with autism certainly can recognize people that they have been exposed to over and over and over before, but strangers they don't have much recognition of, and this is probably likely why we see some of the social deficits that occur in autism. And so I started looking at what does oxytocin do, and is there any evidence, that oxytocin actually helps to accentuate this particular area. And sure enough, there was an article that came out in 2008 in the Journal of Neuroscience that showed that oxytocin modulates the expression of socially relevant faces by specifically influencing metabolic activity in the fusiform gyrus. Okay, and this was theorized at that time anyway, why oxytocin may have a pro-social effect and could be useful as a therapy in things like autism. So this is where a lot of the use of oxytocin as therapy has come about. And we know that, early on things like nasal spray have been used. You can get these from most compounding pharmacies. This has been a therapy that's been used in grief therapy, but it also seems to have some role in helping with social anxiety, improved bonding, and social interest. Usually between 20 to 40 units per ml is a good starting dose. 1 to 2 sprays once to twice daily as needed. Unfortunately, there's not an exact amount that's been determined specific for age or weight, so a lot of it is dependent on how well an individual does, and so working with a doctor to kind of figure out what the optimal dose is going to be. But on average, about a 20 unit per ml spray each nostril daily is a common prescription. And these are just a list of the number of different pharmacies that do produce oxytocin nasal spray, and they also produce the sublingual, which I'll talk about here shortly. Well, just recently, there was an article that was released talking about a study that was just done this year at Yale. Because the whole aspect of oxytocin therapy has been controversial, and there's been some research that says it hasn't worked, and then there's been research that clearly shows that it has. This was a study that came out just recently from Yale called Oxytocin Enhances Brain Function in Children with Autism, and what they did is they took 17 children and adolescents with autism between the ages of 8 and 16.5 years. And they randomly gave them oxytocin nasal spray or a saline nasal spray while they were engaged in some type of social task that involved social judgment. Okay? And what they found, and what the authors commented, was that the brain centers that were associated with reward and emotion recognition seemed to respond more during the social task skill when the kids were getting the oxytocin as opposed to the placebo, which was the saline nasal spray. And they're correct in their assessment is that oxytocin temporarily normalizes brain regions responsible for social deficits. And that's a key word, temporarily, okay? Because even in my practice, I've not seen a permanent fix per se. I've seen improvements with the cholesterol therapy, and I've seen improvements with oxytocin therapy, and I've seen even dual effect improvements by using cholesterol and oxytocin. But I've not seen a permanent fix, a situation where, at least to date, okay, so, you know, and then we're only talking, you know, use of oxytocin, et cetera, over the past 3-4 years, and cholesterol for about the same period of time. So as time goes forward, there may be those individuals on the spectrum, perhaps more high functioning, that, you know, only use oxytocin periodically, don't necessarily need it anymore, but there's still a lot that we don't know because there could be defects in the receptor site that can't be fixed per se, and so there may be certain individuals that just need to stay on oxytocin as an ongoing therapy. And then, as I mentioned before, you know, some of the different types of preparations for oxytocin. The nasal spray is very popular. I started using sublingual tablets a number of years ago, and these actually work pretty well too. I often actually find the sublingual sometimes is easier to administer for little kids because they don't like, some kids don't like the nasal spray. Usually a 5 to 10 unit tablet. You can get higher. I usually am more conservative. I'll start with a 5 to 10 unit tablet 2 to 3 times per day, and I've actually had some situations where I'll tend to use a sublingual tablet which has a little bit more slow absorption to try to create a baseline level of oxytocin, and then use the nasal spray in an additive situation. Let's say if an individual or a child is going to a particular place where they have anxiety. Let's say it could be a mall, a grocery store, going to school, another type of social situation. So the sublingual tablets have been a nice additive or an adjunct to the nasal spray therapy, and it's a nice option to have. And then, you know, oxytocin for adults, you know, matter of fact, 50 units or plus or higher has actually been helpful as a libido enhancer as well. Which brings up a point with respects to oxytocin from a side effect standpoint. I've had some circumstances in my practice in using oxytocin either as a nasal spray in a few situations with a tablet where kids have become, they haven't become hypersexual, they've just increased their social bonding from the standpoint of wanting to be hugged or hugging or being sort of grandiose, the kids who've had some language with respects to their verbalization, almost like the volume gets turned up a little bit too high for them. I've not seen hypersexualization though, or sexual behavior in kids because I tend to use conservative low doses. But again, that's why oxytocin isn't a preset amount based on age or weight. It's really it's a starting place that you would start with any individual and then tailor it, trying to figure out what the optimal dose is going to be. And that takes, sometimes it takes a little while to figure that out. So another way of describing oxytocin, or how it's been described, is a love hormone. Okay, so because it increases bonding and helps to decrease fear in some individuals, it's been considered to be a hormone that helps to increase trust and increase bonding. But in some individuals, it's unfortunately had an opposite effect. There's been some research out of Northwestern University where this was a mouse study, but there is some crossover clinically, where they actually looked at oxytocin and saw an increased triggering of anxiety and fear. And what they did is they took 3 groups of mice, and one group had oxytocin receptors that were completely gone. The other group had increased receptors, and then the third group actually had normal amount of oxytocin receptors. And they took these mice and they exposed them to a community of aggressive mice for a period of time. And then they removed them from that environment. And then about 6 hours later, they placed these mice back in that same community of aggressive mice. And what they found was that the mice who had missing oxytocin receptors didn't really seem to remember what the aggressive mice behavior was all about. They just didn't. Hold on a second. Okay, so I'm sorry, there's a phone call coming through on the other side. So the mice that were missing the oxytocin receptors just didn't seem to remember the behavior of the aggressive mice. Those who had increased receptors showed increased avoidance behavior around those aggressive mice. Those who had normal, or I guess say, yeah, normal levels of oxytocin receptors, they had some avoidance behavior, but they weren't sort of hiding away in the corner in fear. Okay? And so the observation was that oxytocin actually may enhance fear and anxiety in certain future stressful events, or what they observed in these mice or these individual mice. And that the oxytocin actually seemed to strengthen the social memory, particularly in a part of the brain called the lateral septum. And the lateral septum is an area that's involved in the stress response and emotions. Well, the lateral system septum is part of something called the limbic system, okay, inside the brain. And a part of this limbic system is an area called the hippocampus. And the hippocampus is what consolidates short to long-term memory as well as spatial orientation. The hippocampus is intimately involved in emotions, particularly emotions linked to smell. Okay, so the memory of smell, this is why for some people smell has such a significant trigger for past memory. Problems can actually occur in the hippocampus that can lead to emotional instability. As a matter of fact, it's felt that some of the dysfunction with respects to emotional instability in Alzheimer's disease is linked to problems in the hippocampus. Another part of the limbic system is a brain center called the amygdala. The amygdala is found on the medial temporal lobes, okay, close to where that fusiform gyrus is, by the way. It's in that region. And it also has a primary role in processing memory of emotions. And then it sends signals throughout the brain. The amygdala is more involved in the conditioning or fear conditioning and emotional learning, so sort of attaching emotion to something that has been learned in the past. And then if there are any problems in the amygdala, one of the things that can happen is personal space boundaries. Well, if we look at the amygdala specifically with respects to autism, you know, one of the things that may be coming up, and this isn't for all kids, but this certainly happens with this may be linked to the olfaction issues within the amygdala. Certainly personal space problems, individuals being unaware of personal space links back to the amygdala. We know that the amygdala is involved in sensory rewarding. If we go back here where it says involved in award sensations, this can certainly be an issue. Emotional and sensory need for constant repetitive input, constant repetitive behavior can be a problem seen in the amygdala. And then just a heightened sense of fear and anxiety can come about when there are issues occurring within the amygdala and the information that it transmits out to the rest of the brain. Well, it turns out that one of the things that oxytocin does is it accentuates something called extracellular regulated kinases. And these are signaling molecules that increase the brain's response to fear, particularly from past negative experiences. So it's true, oxytocin can be helpful to decrease anxiety, improve trust, improve bonding. But in certain individuals, it may accentuate the fear response. And that, unfortunately, could manifest as anxiety. Luckily, in my experience, and I think from what the research is showing, that Yale study, etc., in the greater proportion of individuals on the spectrum, oxytocin has a positive influence instead of a negative influence. And my clinical practice, I've seen more positives than negatives and more non-responders than negatives. So from a percentage standpoint, a good 80% have responded quite positively. About 15% have not responded, and maybe about 5% or less have actually had a negative experience. Again, it could be dose related. There could be other mitigating factors that are going on, in kids, whether there's other medications, etc., that may be playing a role. But overall, from my standpoint, the story on oxytocin, from an autistic standpoint, is not yet completed. From a mental health standpoint, certainly there could be some application with oxytocin for people with social anxiety, general anxiety. But again, it's a therapy that needs to be individualized and taken on an individual case-by-case basis. So I wouldn't buy into all of the reports that show it to be all positive for all people, or that it has no effect for all people. It clearly is effective. Whether it's specifically effective for your patient or your child, the real test ultimately comes in trying it. Okay. So with respects to the use of oxytocin, there's been studies that have shown that it's helped with decreased repetition. Certainly has been, in some individuals, improved with respects to speech comprehension. And then, as I mentioned, overall, with respects to my experience over the years, there's been improvements in socialization, being more engaged, more playful, less anxiety. So for the most part, it's been a very positive therapy. But again, there are those few outliers where the anxiety sometimes is triggered. The one downside to the nasal spray is with the little kids, they just don't sometimes like the nasal spray, and that's where the sublingual tablets could be useful. I saw 2 adults who actually got a rebound headache with nasal spray. They just felt like it was causing a headache. Whether that's happening with kids, they can't tell you they have headaches. I haven't necessarily seen that as a problem. So the sublingual tablets could certainly be a good option for a wide range of people. Okay, so that concludes the talk on oxytocin. I hope that you found that useful. If you do have questions, please feel free to join me on the Autism Action Plan website, which is autismactionplan.com, and you can post questions through the parent forum. Also, don't forget about the cholesterol piece of this presentation. That's a very important thing. If you personally haven't had a cholesterol done, or you've had low cholesterol, or if you haven't done it on your child, I highly recommend doing the total cholesterol test. Great Plains has a cholesterol panel that looks at cholesterol and other markers. And then if you need some assistance, with that, you can certainly post me questions about it through the Action Plan site, or there's also that site called getsoniccholesterol.com. And this is being recorded, will be hosted on Great Plains' website in the near future through their webinar library. If you want to get more information about me, about my services, my consulting services, I do have office as well as phone and Skype. So I work with people from a health consulting standpoint all over the world. You can email at info@mysunrisecenter.com, or you can call 951-461-4800. And with that, everybody, I hope you found this useful. We will talk to you again next time. Take care.